So, we are doing your corrective transplant today. So, when did you get this surgery done earlier, the first surgery?
February 2021,
February 21. And how many grafts were done?
approximately 3400.
3400. It was done in a single day.
Yes,
Method was FUE.
FUE.
Where did you get this done?
It was done in Bangalore, a clinic called.
Do you know the name of the doctor also?
Yes, I'm forgetting it. It's there in
Acha.
the description.
So, why did you choose that clinic, in
It
Bangalore?
was considered the best in Bangalore, and I didn't want to go out of city.
Okay.
So I was staying along there.
So,
That
you
was the reason.
had chosen the clinic. So, you must have seen some results and something which inspired you to go there.
Yeah. So the thing is that I had seen few results, but for 3 or 4 months when my hair came, sir, it was like very good. After 3-4 months, it was like started falling rapidly.
Oh, after just 3-4 months
4 months, I guess, 4 or 5 months. Fifth month, it started falling.
falling.
Yeah.
So, for first 4-5 months,
It was very good.
very good.
It was very good.
So, were you on
I
any
did
medication?
It, I did it up to here, I guess.
Yeah.
From here to here.
I can see. Yes.
Till here, hair was density was good.
For first 5 months, first 4 to 5 months.
4 to 5 months.
In fifth month only, the hair started falling.
Yeah, started falling.
Are you sure about this?
Yeah. When I stopped minoxidil, that after that it started.
What all medications were prescribed to you?
I think finasteride was there.
Finasteride and minoxidil.
This both.
So, when you consulted the doctor before the transplant, was the role of medicine discussed in the
Yes.
pre-consultation also?
It was discussed, but it was told for me it will be there for the limited times.
What limited time?
For 3-4 months. That is.
They said just you will take it for 3-4 months and then you will stop.
Yeah.
Oh,
And they also explained me like when you stop minoxidil, especially, there will be slightly hair fall, not much, but it was very, it was too much.
so do you know that when you get a transplant done, for first 3 months hair actually enter into shedding phase.
Yes.
So after fourth month is the time when actually growth starts. But you were having excellent growth, best growth of your transplant within 2 months. So it is a shedding phase. So it was not transplant growth. So it had to be something else. It was medicine growth. It was not transplant growth. And that is unfortunate. A lot of people, that is the height to which this can go. Because a lot of people who get the transplant done, who see their colleagues or their friends or family members getting a transplant done, and the results look good, great. They get inspired. They go to that particular clinic, and but that result which inspired them was not pure transplant. It was transplant plus medicine, and where the contribution of medicine was maybe more than transplant. Exactly the case in your what happened with you. In fact, if someone meets you at that time, say 4 months, 5 months, when you have the best outcome because of the medicine, he will also go ask you the clinic's name.
Actually, some of my colleague asked like,
Oh, okay. They went also.
They did not do the surgery, but they went for consultation.
They went for consultation, looking at your result, the first initial part.
Yes.
Oh, so this is the cycle actually. A lot of people, they get into this trap because medicines are important, but the role of medicine has to be clarified in the beginning of journey itself. So the journey says like you start the medicine in case the patient is having progressive baldness. In case the hair loss is stable, you really don't need any medicine. I've got a transplant done 4 years now, but I am not taking minoxidil or finasteride or any other medicine. My hair are good. So not every patient needs it, but on the same note, not every patient can be off medicine. It has to be customized. So when in the other operation theater, we are doing surgery for my own patient. We did his surgery around 1.5 years back. We kept a high hairline intentionally because we did not want to invest too low. So his hair have come up really nice, well, everything is covered. He was grade 6, grade 7. So we did around 4,100 grafts for him in 2 days by combining two techniques, FUT and FUE. And now the scar of the first surgery, the strip line, We are included in the second, and we are again cutting the strip and lowering the hairline. We did not start medicine for him in the beginning at all for 6-7 months, but there was progressive thinning even of the donor. So we had to include the medicine. We started with smallest possible dose, 0.5 mg, 2 to 3 days a week. That means around 1.5 mg per week, and he's on 3 mg per week now. So coming on to the same thing, 3,400 grafts, which first of all, it is almost next to impossible to get 3,400 grafts in a patient by FUE alone, unless the patient is having a really great donor. Fortunately, you have a great donor, but still, looking at the gaps created by previous transplant, looking at the hair which have been implanted in this area, we can easily check and see that they were not 3,400. Had 3,400 been taken out from the scalp by FUE alone, your donor would have been completely empty. Even now, how many grafts have we taken up till now?
600 something. 600.
600. The last time when you got the surgery done, beard wasn't touched.
No.
So we'll be combining the scalp FUE, beard FUE, and then the strip to achieve like 5,000 grafts in 2 days. Now the problem here is, head down please. So the role of medicine again. So a lot of people who go for a transplant at that time, suppose if your doctor had told you that you need to take this medicine for your entire life, you cannot stop, and your result would be too much dependent on medicine, and 80% of the work which you are seeing as a transplant would be achieved through medicine only. Had you gone to the surgeon for the surgery?
No, I don't think so.
Don't think so. You won't have. No one would. So that is number one reason when a surgeon or a clinic does not disclose the way of taking the medicine. So you definitely cannot stop. So this is a lie which is floating around a lot, and we try to bust this myth. And the thing is, people are told you take it for a limited period, then we will stop and taper it off and you'll be able to reduce. No, it is in fact the other way around. You start with full dose. There is something called tolerance. You cannot stop the medicine. You have to increase the dose sometimes in case the body stops responding to the same dose of medicine. You increase it, and when you increase it, you enter into more unsafe territory. So if you start with full daily dose, so your dose was 1 mg daily.
I think 2 mg was daily. 1 or 2 mg, yeah. I don't.
It's a one tablet you were taking daily. So it's 1 mg. So you were taking daily one. So now if you develop tolerance, you will have to increase it further. Increasing it further means going to 1.5 mg or 2 mg daily dosage. So which will obviously put you in a spot of danger. So the second myth, or you can say misinformation around the medicine, is you have to keep taking it throughout life, and there are millions of people who are taking the medicine and you'll be okay and everything. So if the tolerance also have to be kept in mind. We should not start with full doses, but just in a span of 3 months, you saw 2 months, you are telling 2 months, you saw the wonder. Okay. And anyone who has seen such kind of thing, when he goes to the doctor and says, okay, so did you go to the doctor and ask ki, my growth is gone now, what happened?
Yeah, I went there. So he told that it's natural, it will be coming back, but he suggested me to take some PRP sessions. So I took 1 or 2, then I had to leave Bangalore anyway. So I came here.
Oh, so he did not restart the medicine?
No, nothing like that.
So now the thing is, you are being forced to pay for PRP sessions, which are not going to help.
Yeah.
And you spend your money, you spend your time, you give your blood, you undergo a painful procedure and end up having nothing. Did those PRP sessions help?
No, it did not.
They didn't. They will never, because the other patient which we are operating, he in his case we did the transplant like 1.5 years back. Since then we have done just one PRP session. So proper planning. Now coming to the donor usage. So we can see see the donor. A lot of people think that FUE is a scarless surgery, which is obviously not. We can see the dots all around. We are taking a strip from this area, which is kind of more or less untouched. Majority of extraction has been done from this portion. And now we have done these 3 areas. Imagine 3,400 grafts from this area alone by FUE. It wasn't done. So we can see it is not visible also there. So one thing which I see, people who cheat, they are very honest to their cheating skills. So they overpromise the number, they overpromise the skill, but they will never do what they promise. So that is the reason why we have some donors still left. And we'll be taking out a strip from here now, which is going to give me somewhere around 2,800 grafts, probably, maybe 3,000, we will see. And the remaining will do this from this. Now the strip will end up in a thin fine line, and which is the advantage of FUT. For all those who go for a transplant, strip surgery is very important, especially in a repair case. And you will see a lot of people again pushing full doses of medicine and showing it as a great repair transplant. And then again, medicine fills everything up in 2 months, 3 months, and you are again taken for toss. So the advantage of FUT here is that we can get more grafts, by second or third FUT also, if needed. Understood? Clear? Plus, we are not creating gaps at the back. So looking at your hairline, so we can see here, this is the previous transplant. So we can see a lot of gaps in this portion. Head down, please. So grafting is majorly done in this portion and here, and little bit here. So not much. So another problem which I see so we are going to fill the gaps. We are going to retain the line. So good thing about your previous transplant was that the line was kept high. I told you first day when we met. So that is the best part of your transplant, because had it been brought lower, it becomes really difficult to cover the back areas then. And so beard grafts will be put in place in between somewhere. We'll give a little shape to your temple and a central slight cowlick. Majority of grafts will be placed on the left side parting area so that you can cover. Okay. And as discussed, we will be giving you around 2 mg per week finasteride, which you need to continue. We'll take some breaks from that. Maybe, breaks after every 3 months for a couple of weeks. So this is called min-med transplant, where there is least dependence on medication, and still we have some support to sustain the hair growth. So medicine, the regrowth of hair, which you saw with 1 mg daily medicine, that means 7 mg per week medicine last time, you won't see that spurt of hair growth, immediate spurt of hair growth in 2 months. But yes, it will be slow and gradual. It will improve. In your case, this time around, the transplant is playing, you can say 80% part, 20% would be achieved through medication. And last time, the previous transplant which you got, it was almost for the first few months, it was only, I would say 70% result by the medicine and 30% by the transplant.